introduce myself.
Yeah.
My name's Amanda. I'm a late diagnosed autistic ADHD person, age 45, and I'm a mum to two young autistic women, aged 21 and 16. My mum was diagnosed, probably incorrectly, with bipolar disorder. She was probably also neurodivergent, and she experienced problematic mental health, being on a section, and passed away, sadly, age 48. So on to me. I didn't cope awfully well at school, but I do have a first class degree now, having gone to uni in my 30s in HR and marketing, which was very important to me as I'm interested in equality. And I've got a keen interest in career aspirations and outcomes for neurodivergent young people and adults. I volunteer as a peer supporter for local families, which are like my family, for people who've experienced barriers to education. And I also help plan and deliver events supporting women and girls. In my spare time, I'm self-employed as a job coach and CV writer alongside my regular paid work within the Church of England. Never really sit still. My brain's always on the go. Lovingly described by my ADHD coach as a constantly revving Ferrari brain. I always wondered why I struggled with certain aspects of my life, socially, at school and at work, and didn't manage to stay in jobs for more than 2 to 3 years. And I always felt as though I would find out why that was. But the answers I got about being autistic and having ADHD were not what I was expecting. So today I'm going to talk about, eventually, my youngest daughter's journey, who's now 16, and how things began to unfold for her in 2019.
Thank you, Amanda. So I can't remember when we first met.
So I think we met in late 2019 or early 2020 at the Parent Carer Forum for our local authority.
Yeah. So can I just ask you, what was it like for you and your family for you to, before you tried to seek help?
We had a very normal family life, very happy, 2 very quirky children who were very specific and independent and knew exactly what they wanted. Everyone in our home has always been quite literal and eccentric, and we've always trod our own paths as a family. We were never really authoritarian. We were quite relaxed, and our kids never stopped asking questions all the time, which we encouraged. Our youngest daughter was very bouncy, highly athletic, sociable, very determined, never stopped really. But once she went to senior school, the wheels completely started to come off about 9 months into senior school. And school contacted us in June 2019 to tell us that our daughter had written in a book that she didn't know who she was, but she wanted to die. So prior to this, nothing was ever on the radar for us of either mental health or neurodivergency. And we thought that they'd made a mistake and had the wrong student. I couldn't even believe the phone call that I got. We had escalating self-harm with blades following, and she made firm plans to end her life. By this time, she was involved with CAMS because we'd had lots of incidents at school, self-harm at school, but no one was listening. The only thing they would say is that they thought she was autistic. But we were also told, yeah, you're probably very likely autistic, and we might be able to tell you that in 2 to 3 years. So we were told this in January 2020, around the time we all thought COVID was something that was happening to somebody else.
So how did you experience this response to your daughter and to you as a family?
It was really hard. It was really, really difficult. We didn't know what to do. We started looking around for other options in terms of diagnosis because we couldn't wait 2 to 3 years. She was already crashing as it was, and we just needed some certainty and some help, really.
Okay, thank you, Amanda. I'm now going to read the first part of my poetic provocation entitled Psychogenesis. In the beginning, the clinic created pathology and autism. And autism was without diagnostic criteria and lacked research evidence. And controversy was upon the gateway of health. And the professionalisation of the clinic moved upon the gateway of health spending. And the clinic directed, let there be diagnosis. And there was diagnosis. And the clinic viewed the diagnostic process that it was good. And the clinic distinguished diagnosis from controversy. And the clinic called diagnosis healthcare. And controversy, the clinic called irrelevant. And assessments and care pathways became obligatory. And the clinic directed, let there be policies and procedures in the midst of our health spending, and let accountability divide and rule. And the clinic made policies and procedures, dividing health spending, which were under the policies and procedures, from government budgets, which were above policies and procedures. And it was so. And the clinic called the policies and procedures NICE, N-I-C-E. And diagnostic assessments and care pathways were now beyond question. So to continue your story, Amanda, what was the experience of seeking diagnosis like?
We had the door shut in our face by our daughter's school, who literally said to us, no diagnosis, no help. Nothing we can do for you until you've got a piece of paper that will tell us what to do. And of course, nowadays we know that isn't true. But as people that were new to this, we just accepted what we were told by the experts. Left with no option but a 2-year wait, we had to pursue a private route for our daughter. I had to give up my part-time job because she became so unwell and couldn't attend school. She came to work with me. That didn't work, and eventually I just had to leave.
So can you tell me what you did next?
So for our daughter, we sought out a private assessment with an independent psychiatrist who was able to provide her with medication to help bring her anxiety down, which worked. For myself as an adult, eventually I discovered that a lot of the traits that my daughter had, I had too. And I pursued a diagnostic path through Right to Choose through the NHS. I just wasn't in a position to fund it after having to already do it, previously, and having to give up work and that kind of stuff.
And what happened on the day when you received the diagnosis?
So on the day we had our diagnosis, school texted us to tell us not to send her again, because she had asthma as well as autism. She was considered vulnerable to the new virus that we were all worried about in March 2020. So that happened on the same day that we were told she was autistic, and she also had pathological demand avoidance, which is something not a lot of people want to talk about, but that's what we were given, as well as ADHD traits and sensory processing disorder. So we told our family about what we'd been given from this psychiatrist, and they didn't really believe us because she'd always been so happy and well adjusted and did really well at school, and they didn't really want to accept that something like that would be in their genetics, in their family. Some suggested it was me overreacting or not capable of managing a behaviour, but the assessment had come from CAMHS, the suggestion had come from CAMHS. It was never even on our radar, and CAMHS had seen her on a few occasions now with quite serious self-harm. So it was quite insulting and minimising to be treated that way by family, you know, who we knew and trusted. We didn't really care what the answers were. We just wanted some help, however that looked, just to be able to move on from the escalating self-harm and suicidal thoughts that our daughter was having.
Thank you, Amanda. I'm now going to read the second part of my provocation, and it's entitled A Diatribe According to David. In the beginning was the medical narrative, and the medical narrative was with the clinic, and the medical narrative was the clinic. The same was in the beginning with the clinic. All concepts were made by the clinic, and without the clinic was not any medical or therapeutic narrative made that was not made. In the clinic was correctness, and correctness was the people's guidance. And the guidance shineth in controversy, and controversy comprehended it not. There was a person sent from the clinic, whose name was Canna Asperger. The same came for an expert to claim authority of neurocorrectness, that everyone might believe. Canna Asperger was not that neurocorrectness, but was the author of that neurocorrectness. That was the neurocorrect power and truth that corrects every person that is born into the world. So to conclude your story, Amanda, following diagnosis, what was life like?
So given that we'd been told this at the beginning of 2020, things moved really slowly. Everything was closed. Didn't really hear from anybody for a while because, as you all remember, life just stopped. CAMHS put all of our daughter's mental health issues, which were, you know, school trauma as well as autism, they put it all down to autism. Wrote us a letter saying everything that she's ever experienced is because of her autism. We can't help her because we don't do autism. We're not commissioned for autism. So we ended up going back to the private doctor who had assessed her and prescribed anti-anxiety meds and sleep medication to get help, and having to pay for sessions to see somebody because there just wasn't anybody helping. I had to attend A&E right in the middle of COVID in June 2020, which was horrific. It's not something I'll ever forget because we were scared to go to hospital to ask for help because of what was at the hospital. Our daughter was clinically vulnerable. We were told to shield her and not take her out, but we didn't have a choice. I had a child who didn't want to live, and I was surrounded by other people who were genuinely terrified of dying of COVID. That didn't seem to even enter her radar. She just didn't want to live. So whilst everybody else went to school in September 2020 in the bubbles and things like that, she went back and she was kind of edged out really by school, who didn't want to know. She didn't make a month. By the end of September, she was out of school. They wanted her and her growly mum out of school, so they bullied her until she couldn't attend. They picked on her on the first day she went back for her socks. Knowing that all this had happened to her, they phoned home with nonsense behaviour feedback, which was absolute, you know, it was neither here nor there. It was just designed to kind of grind everybody down. So eventually it had to stop. So we ended up with no school place for 12 months. Our daughter's a very, very smart, capable academic child who wanted to learn, who'd always wanted to learn. And we had to take our counsel to tribunal in the middle of all this, whilst kind of supporting her as well. We got her a place at a really fantastic school that had a lot of experience with PDA, which happened to be on our doorstep through sheer good fortune, but we'd never heard of it. The school was very expensive, and there was a lot of reluctance on the council's part to give her a place. But finally, she was somewhere she could recover and have some peace with herself. The cost to mine and my husband's marriage really was at the point of collapse, really, through the exhaustion, having to take your own counsel to tribunal, not having any support from anybody like CAMHS. being isolated in COVID and not even being able to see your family really. Not that my daughter wanted to see anyone because she was so ashamed and so traumatized from being at school. So we both really became carers, and our own mental health was in the floor really. We found ourselves patronised and gaslit by the local authority and CAMS, and they were completely out of the depth with our daughter and PDA. They worked together to try and put her in a cheaper school, which meant she couldn't have done any exams, which was, you know, pretty horrible to find out when you're putting in, you know, you're putting your trust in these organisations, and only the budgets mattered really. So our daughter's now got long-term trauma from mainstream school experience and lack of mental health support, and she's only now just beginning to talk about it, age 16, having just finished year 11. So I feel really today, I just wanted to share that as parents, we're always compelled repeatedly, because no one reads the notes, to explain what's happened, to go through it all, to pick over it all the things that our daughter can't do, all the things that she struggles with, focusing on the deficits, the risks, and the possible safeguarding issues. We have to focus on everything she can't do to get her the most basic help, just to, you know, be a human really, from PIP to getting a blue badge so we can take her into city centre so she can be close to where we're trying to visit. Everything's a battle. You have to evidence everything you claim. I've never been in a process like this in my life, where you have to provide evidence for everything. And it's like being an unending lawyer who's working pro bono for somebody just to have their basic needs met. Nobody wants to talk about the things she's fantastic at, all the talents that she's got. She's an excellent mathematician. You know, she's a fantastic gamer. She's really funny and sarcastic and dry, and all the things that she can do if she has the help to achieve them. So thank goodness for the school, really. So I am still married by some miracle. Me and my husband are still together, you know, and we look back on some of these days with our daughter and we can kind of almost laugh at some of the stuff that we went through as a family and have a bit of dark humour about it, because that's what we have always done. Probably the saddest thing about all of this, and as someone that's tried to turn it into something positive to help other people, is that we are far from the worst story, far from the worst story. We are actually quite a good example of working through this horrible system and having a kind of positive outcome. Our experience is one of the better stories. So I dread to think what other people are experiencing.
Thank you, Amanda, for sharing your story and telling us about your daughter's journey. Okay, so for the third part of my provocation, it's entitled A Polemic from the Peak District, which is where we live. Do not judge or maintain thresholds, that you are not judged as having blocked diagnosis and or service delivery. For with every assessment you write, you can be assessed, and with the criteria you use, it can be upheld against you. Why do you see pathology within anyone, but overlook the faults that others may see in you and or your service? Or how can you say to your patient, let my therapeutic intervention remove your pathology, but don't be concerned about my own practice? You, clinician, first remove any idea of pathology from the concept of autism, and then you will become a person here and now, able to see clearly the neurodivergent person in front of you, needing something from you as a person, as well as from you as a professional. Do not give your expertise to those who pay you, and do not throw potential pearls of wisdom before those who are wiser about the lived experience of autism than you, lest you get negative feedback and a sense of failure from them. Ask them what they need, and resources can then be offered to them. Be curious, and you will begin to understand them. Reflect, and the collaborative way forward for you both will open up. Which of you, if your patient asks for diagnosis, will give them a lecture about autism instead? Or if they ask for advice, give them a list of other agencies instead? If you then, though you are a trained professional, know how to be useful to your patients, how much more will your patients give you positive feedback when completing clinical evaluation forms? So in everything you do to others what you would have them to do to you, for this sums up the ethical basis of your profession, as well as your humanity. And that's the end of our presentation.